Hello, everyone, and welcome to the Corrie podcast. This is where academic medicine meets remote, austere, and resource-limited areas.
So, hello to everybody. It's Tim Cranton again from the College of Remote and Offshore Medicine. And in today's podcast, I am talking to Lieutenant Colonel Chris Corrie. Chris is a very good friend of mine. We've known each other for a number of years now, and have worked together in Wiesbaden in Germany on the International Combat Lifesaver course. That's where we met. But Chris came along and he did a fantastic class on veterinary medicine in relation to military working dogs. And I just thought this was a really good opportunity to have a chat with Chris, because it's something as medics that we won't necessarily come across every day, but we are using working dogs more and more, especially now in places like Turkey and Syria, where they're being used in urban search and rescue. So, like I said, without further ado, let's have a chat with Chris. So, hi, Chris, how are you?
I'm good, Tim. How's it going, man? It's a pleasure and an honor to be here, and hopefully I'll be able to put out some information that maybe somebody can use out there.
Chris, really appreciate you giving up your time for us today. Can you do me a favor? Can you introduce yourself? Tell us a little bit about your background in terms of your job, your qualifications, and what are you up to right now?
Sure. So, Christopher Corrie, Chris. Christopher is what my mother called me when she was upset with me, which is quite often. But yeah, so veterinary medicine started out at the University of Florida. I'm a Floridian in the university in the States, and University of Florida in Gainesville. So did my undergraduate, continued to the College of Veterinary Medicine, graduated in '91. Did some interesting stuff in Taiwan, strictly as a civilian. I worked at the zoo, that kind of stuff. Came back and worked as a civilian vet, did a lot of emergency medicine, and in 2008 made some big decisions and ended up in the U.S. Army. Ended up in Afghanistan about a year later at the end of 2009. So a tour there, 2009, 2010. Did a few things here and there, ended up back in Afghanistan 2012 to 2013. And then a few months after I got back, entered the emergency and critical care program at the University of Florida residency. So it's a specialization track, not something you're required to do as a veterinarian, but if you want to specialize, the Army felt like I needed to be smarter. So they sent me to school to do this 3-year residency. So 2013 to 2016, successfully completed the residency. In 2016, ended up in Germany soon after. Germany up through 2019. Ended up in South Korea and was there during the whole start and run of the pandemic, the COVID pandemic, and ended up transitioning to the reserves. And I was able to get back to Germany. It's one of those old sayings, I had to see about a girl, and came back. Civil Affairs Unit in Europe in the reserves. We worked with the Afghan travelers as they were coming through. That was really special for me as well. And so Civil Affairs Unit, and now I teach ILE with the 7th ILE Detachment in Grafenwehr. So ILE, intermediate level education. It's a college course essentially for the military that you use as a transition for promotion from major to lieutenant colonel. It's a very important stepping stone for the education for officers in the military. And so that's what I'm doing now. And I'm also working as a veterinarian in veterinary hospitals on different bases here in Germany. But married last June with that girl I mentioned. Thank you so much. Mary and I, we live in Germany and no plans on heading anywhere else, but I did get picked up for an involuntary deployment. I'll be in Kuwait later this year. So interesting times, but veterinary medicine has always been the basis, and emergency medicine is what I really do enjoy for sure.
So as a military vet, obviously you've worked very closely with working dogs. Can you tell us why a knowledge of veterinary medicine is important for medical personnel working either in the military or possibly in a wilderness or remote setting?
Well, it's a really good question because, I think the expectation is most people think that working dogs are always going to be around veterinary medical personnel, whether it's a veterinarian or someone that works as a veterinary technician, veterinary assistant, what have you. And the fact of the matter is, there may have been a time where that was true, but certainly since the war in Afghanistan, the military working dog, particularly for the U.S. services and all around the world, have been a much greater cornerstone of a lot of things that we do. They've been, technically termed as force multiplier, but there's so much more than that, and so they're everywhere, much more than people think. The problem is that keeping up as far as having as many veterinarians and veterinary medical personnel available and in and around where they are is not always the case, and so we've learned that the hard way sometimes. And so more and more we're working to codify all of the things that we know about emergency medicine and pushing that information out, both in information digital form, hard copy form to medical professionals that work with humans, and then also with the individual soldiers and medics in the field that are more used to dealing with humans, but making sure that they have a familiarity, because a lot of times they are at the point of contact for injury and they're the first ones giving care in a situation where those MWDs, whether it's a traumatic incident or something that's quote unquote run of the mill kind of thing, but still very important to immediately jump on so that those canines are healthy and ready to go and do their work. So it's really important that anyone with a medical background, and particularly anyone that's even around canines in the field, whether it's contract working dogs or military working dogs, at least has a general understanding and comfort with doing the basics with these amazing soldiers and four-legged soldiers and partners that we have in the field.
So what kind of work might working dogs be involved with? I mean, I think I mentioned search and rescue, but that takes a certain type of dog, I guess, cadaver dogs or something like that.
Sure. So there's all kinds of specialties, and a lot of these dogs will do one to two things really, really well. Occasionally, in the soft community, they might even do more, but primarily they're looking for things, whether it's things that can hurt us or things that we need to make sure that aren't entering the areas that we don't want them to be entered, or have contact with our personnel, whether it's drugs or contraband, weapons and explosives and things that we need to make sure that they find, and also particular individuals and finding particular people that are important, high profile individuals or individuals that need to be found or located, whether they're lost or they're someone of interest. So they're doing so many different things, and many times, again, that they're used for one purpose or a couple of purposes, typically in order to focus their expertise.
I mean, I understand, correct me if I'm wrong, that a dog can actually detect if somebody's having a hypoglycemic event as well.
Oh, sure. So, there is that aspect of canines being used to detect things like certain medical conditions, including seizure events. That's been, those are the kind of things that are fascinating. So it really is not only just the idea that they can do things that are not necessarily military or mission related for governments and things, but also health related for people. And so, the military working dogs, contract working dogs in the field, and then those trained animals that are guiding people that can't see, or making sure that people have seizures are cared for, and they know that something's going to happen before it actually physically happens, so that they're safe and protected and not in a spot where they could injure themselves during the event.
So is treating dogs the same as treating humans, or is it different in any way? Is there a special algorithm that we might follow?
Yeah, it's interesting. I think through any time that we're doing these events to try to uh, teach individuals the basics, the canine TCCC, that the trauma course that we work on, that is being consistently tweaked and changed and modified and strengthened and simplified and all that kind of stuff. Before any of those courses, I think for me, one of the most important things when you talk about is there a difference, I think it's important because a lot of people are very much fearful that they're going to do something wrong or that there's no way that they can take their medical knowledge and apply it to dogs. So one of the first things I think is important is to get off the table is to say there's more similarities than dissimilarities. And sure, it doesn't look that way right now, but here, let me kind of go over the anatomy and you can see how much is the same. And once you start going through that process with a lot of people, it relaxes them to the point that they see that there's a lot of stuff that pulls over. And sure, there are some important differences, and those are things that we try to touch on. But more than anything, doing nothing can be more dangerous than doing something in a way that's appropriate, that you're not going to be injured, that you're not injuring the canine patient, and feeling confident and comfortable in the fact that there's a lot of similarities in the information and the training that you receive for humans that can be almost directly applied for the dogs.
So I guess I'm kind of thinking in a trauma setting. So we're looking at the CABCDE or the MARCH, MARCHE. That's going to be pretty much the same then for a dog as it would be for a human.
Right. So the canine TCCC, good point. So the canine TCCC uses this acronym, so MARCH, and initially it was M2ARCH, and that was March. So you try to make something that's rememberable, right? So back in about 2019, September, October was one of the most recent updated version of the digital format that's put out as far as the document that outlines canine TCCC. And what they did is they added an M and they added an E to the end. So it's M with a 3 at the top, ARCH, and an E. So the big thing, not only telling people that there's more similarities than not similarities, getting them off the table, the next most important thing is the first M in that whole acronym is muzzle. So we're dealing with dogs. The biggest thing that we worry about is anyone that's trying to help them ends up being a victim, a casualty, and then no one's going to be able to help. So now you have, instead of one casualty, two. So muzzle is the first M. Massive hemorrhage, dealing with hemorrhage, same kind of thing with human trauma, basic lifesavers course, combat lifesavers course, any of that kind of stuff that's taught. And then the additional M that was added was medication. So they felt that it was important that we make sure that people realize that there's pain control and potentially sedation that needs to be added during the early stages of care. Moving on to the A's, airway, after that respiratory, and that seems to be the same thing. It takes up space, its own individual space, for a big reason. Airway is an open airway. Respiration is the actual ability to breathe. So you're checking both things. C is for circulation, the two H's, hypothermia and head trauma. And then the E that they added, hang on to your seat. It's amazing. It's everything else, right? So I read this and it was kind of funny. I mean, I can see these group of professionals sitting around and saying, we need to add something, and what should we do? And they come up with E for everything else. So that's really more about the reports, and that's that continuity of care that it's so important. I think that people forget, and that making sure that the information from the point of care all the way through when those patients, whether they're 4-legged or 2-legged, get transferred to higher care, everyone needs to know what has happened and what the situation is and what to expect. And so 9 lines and misreports, but not only that, things like antibiotics, which are something that can be done at the end, but shouldn't be forgotten as well. So March, M3, ARCH, 2, and E is a good acronym to know. It's a good basis, and it's a solid basis for canine TCCC.
I mean, I know, I certainly know we like our checklists. And the idea of having the checklist is making sure we don't miss anything that could be, critical. We need to find and fix those life-threatening conditions. So, in the case of, obviously, we've muzzled the dog, so we've now made sure we're safe. So the other M is massive hemorrhage. Can we use limb tourniquets on dogs? It's a question I kind of get asked on a regular basis.
Yeah, the question is, and there's so much that changes, and anyone that has dealt with emergency medicine, it can be a fairly frustrating thing if you look at it one way, but on the other way, it's exciting that there are changes because we learn and we continue to learn. Sometimes by experience and sometimes by loss. So when first came out, when the TCCC and the whole process of care under fire and tactical field care and evacuation care came into the scene and was taught, created by the SOF community and passed on. One of the most important instruments, as you know, is that tourniquet, that cat tourniquet, that life-saving thing that really turned the corner. And I don't know many medical personnel now that don't drive around with one of those things in the glove compartment minimally. It's amazing. Um, and initially it was thought, wow, this should be a direct kind of move. But the problem is that looking at these dogs, there's a couple of things to keep in mind. Their limbs, if you look at them, they're typically an upside down triangle from the shoulder to the elbow and from the hip to the knee. And if you can picture putting on one of those tourniquets at the widest part of an upside down triangle and look what gravity will do, it obviously is going to slip. And in fact, a case that I dealt with in Bagram was a case where the handler and the dog were injured in a wadi. He was being cared for, the dog was being cared for. They put a tourniquet in. By the time they turned around, that tourniquet had slipped and the dog had bled out. So we know from personal experiences and from, actual field events that those kind of tourniquets, these windlass, windlass, however you want to call them, tourniquets, just are simply not good. So we talk about the SWAT tourniquet, these more of the elastic kind of material as a go-to if it's required. Yeah, exactly. But the thing about it is that, it's interesting because we really don't push for the most part tourniquets to begin with, and we talk about actually pressure. So all that kind of combat gauze material, all that kind of stuff that's been it's been talked about and advertised. That's the go-to for dogs. Dogs have a tendency to basically clot and handle hemorrhages. Their body handles hemorrhages, particularly in their limbs, different than we do, than our body does. And going back, there's actually a paper that was put out that went back into the early 2002 to 2013 or somewhere around there, and picked this group of 20 plus military working dog casualties that were treated. And the significant portion of them had initial contact with injury was so significant that there was no return. Remember, these guys are out in front. They're the tip of the spear. They're in front of the handlers. And so they usually receive, and at times everything that was designed out there as far as booby traps was designed to basically trap and hurt and kill the dogs and the handlers because how effective they were. But the dogs that actually survived the initial incident, there's all of them that had the injuries that they talked about. None of them used tourniquets. All those survived. And so we went from an idea of we have to, since this whole cat tourniquet thing turned the corner for casualties for us, it must go to dogs and it has to be this way. And then we realized in hindsight that no, we don't necessarily need tourniquets involved in the care of dogs every time. And that pressure bandages is really our go-to.
So obviously the dog has fur. Do we need to worry about hypothermia management then? I know you mentioned it before in using the Marshall, the CABCDE algorithm. Do we need to worry about hypothermia management?
Yeah, you're right. I mean, it would seem to be that anyone walking around with a fur coat, particularly in warm weather, is fine. It shouldn't be an issue. And the situation that's so important for human medicine, and we realize that we found that it's the same for the medicine for our canines, is that your ability to clot, your ability to stop the loss of blood, which is so critical in your survival, is. And a lot of us went through biology and we saw that little intrinsic, extrinsic chart, and it had these Roman numerals, the 2s, 3, this goes to that goes to that, and the clot's formed. But in between all those numbers are these organic little engines called enzymes. And outside the temperature range that they're going to function, they don't function. So everything falls apart as far as your ability to do that. There is this triangle, the triad of death, as they call it. And one significant portion of that is the temperature. And so it's such an important part of the process in caring for the traumatized patients. And that includes dogs. Even with a hair coat like that, there's a tremendous amount of heat loss in a situation where they're traumatized. They may be in a cold atmosphere, they may be wet, and there may be open wounds where a lot of that heat is dissipating, and they're unable necessarily to regulate their body temperature well. So yes, in fact, long story short, hypothermia is a significant issue, and it is a major concern for trauma in all trauma patients, including dogs. Absolutely.
Because I've always heard that dogs can get too hot, and especially if they can't pant. I think there was an issue, if I recall from your presentation, about dogs wearing muzzles. But if they can't pant, then they can't lose heat.
Right, exactly. So these, remember, dogs don't sweat, and their ability to regulate their body temperature has a lot to do with their mouth. And so we talk about muzzling these guys and using these basket muzzles, or muzzles that allow the opening of the mouth to some extent and then direct change of air. But when you're dealing with minor injuries, so many injuries, as happen to the dog's feet and ears and tail. And so when you're going for injury care that is minor, or you name it, these guys have lameness issues, they strain themselves, they get bitten by something, what have you. That's a whole different ball game. But when you're talking about trauma, that's a whole different world. And so these guys that are heavily traumatized, and you're in a situation where you're reaching for that whole algorithm, that whole acronym for March, and you're going through the process of checking airway and breathing, you're dealing with a patient that is in a whole different realm of care, because that situation, their body temperature cannot be regulated very well by them. And in a situation like that, you're absolutely right. We always worry about these guys overheating, but in a trauma case, and particularly with blood loss and maybe open wounds, we worry a lot more about them being too cold. And so making sure that they're wrapped and making sure they're warm is part of that algorithm. Being able to check their temperatures, which we can do, and monitoring them is so important. Plus, if you end up giving fluid to these guys, you're automatically going to drop their body temperature, and you need to balance that by making sure that they're wrapped and kept warm.
I mean, I mentioned before that there are search teams with dogs in Turkey and Syria just doing amazing things right now. And obviously there's a concern, that they would get injured themselves. Do they need to wear any protective equipment? I mean, I think I've seen booties or something that dogs can wear.
Yeah, it's a really good question. I wish those booties were available more often, but they're not the cheapest thing. You figure dog booties, it shouldn't cost that very much, but they can cost hundreds of dollars. And a lot of times, a lot of these working dogs, whether they're contract working dogs, military working dogs, or what have you in the field, not all of them have received all of that gear. We'd like to believe that they do, but not always. And it takes some training to get used to those things. It really, I mean, it's one of those fun videos to watch some of these dogs get those booties on the first time. They're hopping around like they're on eggshells. But in the long run, once they get used to it, it's a lifesaver. We've certainly seen these guys out doing patrol work on very hot surfaces and coming back with significant burns in their pads that put them in kennel and off work for weeks until that heals. And they'll never stop and tell you that there's an injury. Most of the time, the handlers are trying to be very cautious, but finally notices as they're walking, they're leaving these blood prints behind with their paws. So the first thing is that's important for heat and potentially sharp objects is wearing these booties. Additionally, a lot of these guys are wearing something to cover their eyes, making sure that things that are happening and continually going on, there's falling debris from some of these unstabilized buildings that aren't around. And some of these things can ricochet, and be careful of putting on goggles, just like the care workers in the field are doing, but getting them used to that as well. Not only booties and goggles, obviously, it's not something that dogs are naturally going to. And even on aircraft now, where it was never done. And in fact, it seemed like it would never be a normal. We're trying to get these guys to wear ear protections as well. But in the field that you're talking about, like Turkey, Syria, that kind of thing, yeah, the basic bottom line, the basics are booties to prevent foot injuries, and then potentially goggles to prevent injuries to their eyes. But as far as all that extra equipment, having these guys breathe through, different devices that filter out different debris, all that stuff, obviously during 9/11 and the towers, realizing that all those care workers were dealing with inhalant injuries for the exposure to things that are in building materials that were burning. The same kind of can be true right now in Turkey as well, but we haven't developed anything that would work for them in a working situation that they can adapt to as far as controlling what's going into their breathing system. So keeping these guys away from that kind of those kind of fumes and making sure they're able to do their work but do it safely. It's a big job. You're trying to keep yourself safe as well as the dog. It's a big deal.
It
Yeah.
sounds like a significant challenge trying to
Yeah.
keep the dog, safe. That asset that plays such an important role.
Absolutely.
These animals are doing things that certainly humans can't do, and arguably technology can't do as well.
Yeah.
Is there any? We've talked a little bit about trauma, and I guess it's kind of a given based on some of the dangers that in the areas that these guys may go to. But are there any common conditions that dogs suffer from that maybe we should be concerned about?
So one of the biggest things that we worry about, and it was actually the largest life takers of these military working dogs in the field, was the old GDV, or gastric dilatation of volvulus, that condition where we know that there are certain factors that seem to create an increased chance or possibility of this condition occurring. But it's one of these conditions that will hit right out of the blue. You never know. The stomach fills with typically air, fluid, food. It then twists itself, and you have basically an emergency surgical situation. And so, as a preventative, and why we were able to take that GDV death out of the top categories for taking the lives of our four-legged soldiers, were actually going through a surgery that basically pexies the stomach to the body wall to prevent that twisting. And so, you'd figure that, okay, so we went through all that experience and knowledge and real life experiences of losing these guys. Then it means probably all these dogs in the field are going to be go through the surgery to this prevention, and that's not the case. And so, in fact, I did a little work in Iraq recently, and was there a couple of weeks, and the person I was there with said, this is going to be just really chill. I'm sure that you get to work out and read and stuff like that. And sure enough, within a couple of days of him saying that, we had one of the dogs had a GDV. So away we were doing surgery in the field, wafting away flies. So I was trying to get the surgery done. And he went on to do well, but it's one of those things that you have to be prepared to do. It's a big deal in the field. You talked about anaphylaxis, sure. A lot of these guys tend to react just like we do to bug bites and things like that. Thankfully, we don't deal with a lot of severe anaphylaxis with these guys. At the same time, though, these guys are curious. They're meant to be curious. They're taught to be curious. And so, they tend to get into trouble. And so when these guys are investigating things, we talk about insect bites from potentially venomous animals, including snakes. And we also deal with these guys swallowing things. So being prepared to deal with a dog that swallowed something that's potentially life-threatening or potentially injured by venom from either an insect or a snake, for example, is something that you also need to be prepared for in the field when you're dealing with this kind of stuff as well.
So if I was going to have any additional items in my medic kit for a dog, what would it be? Or am I okay with everything that I would normally carry for my human patients?
Well, I mean, a lot of the stuff that you use for human patients, including a lot of the medications, are directly transferable. Common drugs like morphine and ketamine certainly can be used for these guys. There's certain drugs that shouldn't be used. But as far as the medical care and the instruments and the tools that you're using, including the combat gauze that's most commonly used, um, that kind of stuff is directly transferable to these guys. Um, when I talked about some of these things as far as them getting into and wanting to help them out, we do, we think about this and it doesn't happen all that often, but there are a couple of medications for dogs that are very helpful to um, get them to vomit. I think probably the most common thing that people have reached for, particularly for their pets, is hydrogen peroxide. Um, there's a lot of dosings out there for hydrogen peroxide used and given orally. Some of these guys can get, I think the maximum is with the current thought process is maybe 15 mils per dog. The range goes anywhere from 1 to 5 mils per kilo kind of thing. I saw one reference of a teaspoon, which is about 5 mils per 5 pounds. And so given orally, that will make these guys typically 9 times, well, I'd probably say 70, 80% of the time vomit within 10 to 15 minutes. It can be reapplied, for example. But the problem is that, for a long time we used that as the go-to, and there's been some research and papers that have come out that talk about the damage to the esophagus, the food pipe, when that occurs and is used. And so, if possible, we really try to steer away from that. We went to something called apomorphine, not an easy drug to get a hold of. It typically comes in a capsule form. If you're able to get those capsules, they typically come in 6 milligram capsules. It's really something that you want to keep close as far as your toolkit for these guys. It can be given as a powder dropped into their conjunctival sac. So you pull back the eyelid, you drop it in. It causes the eye to be extremely red and irritated, but a significant amount of the time that will get these guys to vomit. After they do, you wash out their eye with saline that you would use for humans as well. And we've actually, since 2020, there's a new product that was on the market that was recently licensed. And so it's ropinirole, I believe it is, ropinirole. And I think that the name of the product out there is called Clever, Clevor, and it's a product that comes in a liquid form, and so you actually drop it right into the eye. The restrictions, which shouldn't be effective for typically military dogs or working dogs in the field, it's above 4 months of age or 4 or 5 pounds. It has to be greater than to be used, and it goes all the way up to like 220 pounds or so. So there's a huge range. But it's extremely effective. They both use the same mechanism of action, dopamine agonist, I believe. And then it does not work for cats. Cats, as far as their vomiting mechanism, is a different pathway. But so those are products that I think these days, if you're going to be in the field as a medic, I think it might be nice to talk to your vet and see if maybe one of these products you could use or keep in your bag, along with potentially even Benadryl, injectable Benadryl, for those cases of these dogs that get into trouble from stings of insects that don't have necessarily a very severe effect, but you've got a swollen face or a swollen area, and you want to try to reduce some of the swelling and the pain as well. That might be effective.
So could you give drugs like paracetamol or ibuprofen?
Yeah, that's a really good question. We really try to stay away from NSAIDs, the non-steroidal anti-inflammatory drugs you talked about, and in particularly, there are, if you look out there, there are going to be dosings for things like Tylenol, but it just, in my hands, it really has not been an effective tool, and it tends to, and we worry about the kind of damage that it does to your digestive system, and is it really that effective? Is it worth the risk? There are certainly non-steroidal anti-inflammatories that are used, but we really try to stay away from the stuff that you would normally find in your cabinet that you would reach for your own discomfort. But yeah, there's certainly a list out there. The Canine TCCC groups out there will have a list of drugs and dosings. People are usually pretty surprised by the level of opioids. Dogs take a tremendously much higher dosing of things like morphine or hydromorphone to be effective. And then fentanyl works. We do use it, but it typically is not a singular injection drug. We typically need a constant infusion of that drug to be effective, because it's basically turned up and churned through by the dog system so quickly that it's not effective as a single dose. But yeah, a lot of the drugs that you would find in medics bags that you use for critical care in the field, you can apply to the dogs. It's just a matter of dosing appropriately and staying away from some of those
And
drugs like you
could you
mentioned.
do the same intranasally as well?
Well, we don't talk about and utilize a lot of the drugs as far as pain medication intranasally that we do in people. A lot of that I think is just because it hasn't been studied. I'm sure there's information out there that's floating that's case studies kind of thing. I did it because I needed to and intended to work, that kind of thing. But overall, our routes are intravenous, intramuscular, under the skin, or subcutaneous and oral. And nasal drugs are just not the typical kind of deal. One of the caveats we talked about, that drug, the Repinerol, can actually is made to be drops that are placed in the eye that causes a systemic effect. But for the most part, injectable, stay with the injectable or oral for those drugs, and just follow the guidelines that are out there. And they're pretty straightforward.
You said dogs aren't kind of great communicators. I mean, are there any obvious signs that we can maybe look for to see if there's a problem?
That's a great question. It's the kind of thing where if you've ever been around a dog and you've entered a room, let's say, for example, a dog's in a room, you enter the room, no matter what that dog is doing, whatever the dog is chewing on or involved with, you're going to be the center of the attention of that dog when you walk into the room. And so if you walk into an area with one of those working dogs and they don't immediately look at you, or they aren't immediately focused on you, there's a problem. So the communication obviously is a tough part. Asking, we're taught as in human medicine, as medics, and the combat lifesaver course and the TCCC course for people, that the communication part is a much more significant role than it used to be, and talking to them and asking them what they need and how they feel and is this okay. But for the canines, simply getting their attention and making sure that they're focused on you and have the ability to focus on you is a major factor. If they are too busy breathing and they're not paying attention to you, there's a problem. If they're not moving or they're looking somewhere else, there's a problem. And so, that's probably one of the key factors. And if you're already in the room, if you crinkle a wrapper or you show them a ball or one of their approved play toys, like a Kong, for example, and they're not immediately focused and zoned in on that, then again, you've got a problem going on.
Can you do CPR on a dog?
Absolutely. Absolutely. It's something that, in critical care, we're probably performing CPR on a dog on a regular basis, at least weekly, minimally. And, although CPR, as you know, in human medicine, as well as veterinary medicine, is not the most successful thing in the world. Once you do it and you do it well, and you are able to get a dog back, or even a cat, obviously we don't have military working cats, but any of our pets that you do CPR on and you get them back once, then everything else is worth it. The thing about it is, though, when it comes to the life-saving courses that are taught for our military, we used to teach CPR, and as you know, we've gotten away from that. We get to a situation where in the field, CPR is such a intensive process that we're steering away from worrying about the CPR, focusing more on those critical care tasks and the basic care for injuries, and leaving CPR to medical professionals. But if you're a medical professional, if you're in a forward, an area that's in the field, and you're providing care for the people in the field, you can certainly learn to do CPR, and it's a very valuable kind of process for the dogs that are in the field that may require it as well. But as far as medics and then first point of care, again, the same thing goes for our humans. We've kind of steered away from that aspect and focused on other things.
So, I mean, I have to ask, have you ever encountered any interesting or particularly challenging cases during your time as a vet? I can recall an occasion where, again, in a remote setting, and I had horses that were in a trailer, and the trailer turned over, and then we had to do some do some stuff with the horses. Thankfully, they weren't too bad. Getting hold of a vet was obviously really difficult. You know, it took a long time to be able to get a veterinary surgeon to the animals, and all we could really do was just try and keep them as calm as possible and keep them warm. But I always wonder, was there anything else we kind of, you know, could have done in that setting? Have you ever come across anything, you know, challenging like that yourself?
You know, we had talked about this before, just out for fun and stuff, and it's typically with those oh wow or oh cool stories. And I think any veterinarian that's been out there, yeah, in private practice and also the military, you come across these kind of off the wall kind of things. And I've certainly done things like being presented by a 4-meter python, and I had a electrical cord dangling out of his mouth at 2 a.m. because he swallowed the heating pad, and dealing with that for 2 hours. Being presented by in some of the more rougher neighborhoods, the emergency clinics I worked in downtown Miami. At early in the morning, being presented by ladies from the street corner with a poor kitten that was anemic and pale and bloated because they're so full of intestinal parasites, and they're pulling money from their purses and their bras and all this kind of stuff in order to help this kitten. And you end up pulling some blood from the house cat and doing all that stuff and tell them to keep their money and caring for the cat overnight, and they're picking up on Monday. And those kind of things that are just the unusual stuff that you don't typically see, the vaccines or Fluffy's itchy or MWD, G's double 07 kind of thing, stubbed his toe or caught his tail in a door kind of thing. Even a butterfly that was brought in one time from a teacher who they were doing the whole process of metamorphosis, and they didn't realize that in a dry environment, these butterflies can't unfurl their wings, and they wanted to see if they could get splints on these butterflies' wings. And those are the stuff that is, you think back, and it puts a smile on your face and you share. But I was thinking about this after we talked before, and I did want to mention something. It's not just the story, but I think it's something that I think it's important for anyone dealing with these working dogs in the field, is dealing with that aspect of their care that no one really wants to deal with, and no one, we all hope to prevent, but dealing with these guys that don't make it in spite of our best efforts. And it's not necessarily one of the more interesting stories, but I have to say that it's one of those things that I think needs to be addressed. If you're in the field, you're dealing with these guys, and if you work with dogs enough, unfortunately, and depending on the environments, you might very well deal with a case that you lose these guys. And so it's something that is a little different than everyone wants to do the TCCC, and I get all that. I'm so excited to teach people, and I'm so thrilled when people walk out more confident, and I know that it's potentially that they're going to save a life one of these days. If you're not able to dealing with the loss of a dog, you have to understand that these handlers and the dogs are closer than family, and I think you've seen that, and you know that.
Yeah.
These guys are exceedingly close. And so 9 times out of 10 when these guys are in the field and the dog is traumatized, the handler is traumatized as well physically. And I got to tell you, these handlers that are separated from their dogs. They'll pull out catheters and push medical personnel aside to get to their dog. They're extremely tight and close, and occasionally we lose these guys. And being able to deal with that, knowing what to do, being able to try to figure out, what am I going to do? We're in the field. We have this really horrible casualty kind of thing. What are we going to do now? And not only that, I think years ago when you and I were kids, when you lost a dog or cat, you man up, as they said, right? But we realize how much of a part of the family our personal pets are, and certainly even our working dogs are. And the loss of these guys is as traumatizing as the loss of any of our brothers, right? Or sisters. And so I think it's important to realize that. And if there are courses out there on dealing with that aspect of medicine, and dealing with even potentially in veterinary medicine, euthanasia, compassionate euthanasia, and the loss of these guys. And there's there's classes out there or instructions or talks, get in on that. Not just the exciting, how much combat God's going to get in this wound. Get in on the stuff about potentially dealing with this kind of case and this kind of situation, and making sure that you're looking out for yourself, you're looking out for the handler, you're looking out for everyone that's been involved in the case. In veterinary hospitals, teaching hospitals in particular throughout the United States, you're typically not going to go to veterinary hospital, a teaching hospital in the United States without having a psychologist on staff there. And there are plenty of times where we'll reach out in cases where I've certainly dealt with cases for compassionate euthanasia, where I was worried about these owners going home by themselves. And I said, you know what, do me a favor, hang out. We've got someone, I'd really like you to talk to them. And so, it's a whole different world out there. We're willing and able to talk about the traumatic situations that we all live with, being out in the field. We realize that we're no less of a soldier, no less of a man, no less of a woman, no less of an adult, feeling the way we feel, having the nightmares, and talking about that and dealing with it. And I don't want to be overly dramatic about this, but at the same time, I don't want to underplay this. I think it's something that, Hollywood doesn't always put on the screen. It's like we always want the characters that we're rooting for to survive, but not everyone survives. And that includes our four-legged companions, both at home and also in the field. And so I think it's really important that if you're a medic and you're dealing with this kind of stuff, as much as you deal with on the human aspect, you need to be prepared for dealing with this in the field and what to do if it happens to you or you're involved or you're around something like that as well. So again, I'm sorry, I don't bring down the tone, but I was thinking about this.
No,
and I know
it's
that,
really important.
Well, I mean, all the vets have these stories, right? So the Thanksgiving meals and the dogs brought on in the emergency clinic, I've certainly done it. And you take an X-ray and they swallow the turkey knife handle first, usually a wooden one that was all greased up, and those oh wows of the dogs that eat so many rocks that you could fill up a bag and beat a grizzly bear to death with it. And so, that's always the oohs and the ows and the wows, and so that's always fun. And it's always kind of fun with the beer sitting around medical professionals. And certainly when you talk about human emergency stuff, some of that stuff just blows my mind. I've certainly hung out in the field with these guys doing laps around fields in the morning before getting together. And these human trauma people talking about what people do themselves and all the stuff they see in emergency rooms. But, it is an aspect I think that doesn't get enough attention because it's not fun to deal with. But, we deal with people making very difficult decisions, very, very long-reaching decisions for a lot of pain and trauma because this kind of aspect wasn't talked about or dealt with. So yeah, absolutely.
Yeah, it's important to make sure that we're in a position to be able to provide that psychological support. Yeah. I guess on both sides, because arguably a dog could lose its handler as well, most certainly in a military setting, and then we would have to obviously control the dog. I think for me, being a vet was a missed vocation. I was brought up on the farm, and I was going to be a vet. And when I was younger, I was my parents had arranged for me to go with the vet and just do his rounds with him, for a day. And before I, decided that if that was the way I wanted to go, and he was an equine vet as well, and I just remember how big and powerful horses were, and I can see the damage that they can do, including cattle, and it kind of put me off because I was kind of like, there is no way you're going to get me, because I could see what they were physically capable, of doing to another human being. So I figured that human beings would be an easier option. But I just find the subject really, really interesting. And when I first met you in Wiesbaden and you'd introduced the military working dogs course, I was kind of like, yeah, this is great. I wish that it had been introduced into the whole kind of combat lifesaver and pre-hospital care in general, because I think it's really important. And again, I think it's a subject that gets missed, and which is why I'm really grateful for the opportunity to talk to you this evening about this subject. So before we go, is there anything else you think that you can think of that could be useful for us medics working in a wilderness setting or working in pre-hospital care? And do you have any golden points?
Yeah, I think, no matter the situation, if you're in the field as a handler, as a medic, you're around canines. Sometimes you have to. One of the most important things is getting to know, meeting, and breaking sometimes the artificial barriers that exist between yourself and other groups that are co-located. And so, making sure that as a medic, you're getting to know these canines, the handlers. You might even get to the point where you might even want to, if you're going to be in that setting, you carry your own muzzle, your own basket muzzle. You can talk to these handlers. Maybe they have an extra one that you can always carry just in case. They'd be thrilled to make sure that they've got backup. Getting to know them, getting to know their dogs, making sure you know their weights. A lot of times they'll have these drug cards with them that have the drugs already laid out as far as what that dog should receive in case of different emergencies. Getting a copy of that, keeping it with your material, and then turning around and connecting them, if they haven't already, with the human medical providers that are out there as well. Because that's the first thing I do when I go out. I introduce myself to the medical personnel, the human medical personnel. We get to know each other very well. I talked about that episode that I had to deal with in Iraq early last year. And I had already introduced myself to the human hospital, got to know them. So when I needed to get x-rays, I walked over, they were totally down with it. And in fact, one of the anesthesiologists, a doctor there, when I came in, said, "Hey, can I help you in the surgery?" And so it really helped a great deal. So for example, I can't stress that enough, connecting, networking immediately on the medical side as a medic, not just to the medical providers out there that are running a hospital or a care tent or what have you, but also to those handlers, to those dogs, and making sure that all three of you, all those groups get together, know each other. And I tell you, although we really stress that military dogs or these working dogs are not pets and they should be treated as such, I can't tell you how much of a moral, just how high and how much you can elevate someone's day just bringing in a dog to a hospital. It's just it's the highlight of the day. They love it. It's a connection, and it really makes a huge difference. So getting out of your little your corner, making sure that you get out there, even if you're an introverted person, you got to get out there, get connected, make all that stuff happen. And worst case scenario, nothing happens, right? Which is actually the best case scenario. And you haven't wasted your time. You've done something special, and maybe you can do some teaching. Those handlers, maybe the human providers went through a recent canine teachable C, and you can all get together and go over stuff and learn stuff and get your hands on. So connecting, networking, and making those connections. I tell you, you never know when it'll be a life-saving kind of scenario. So
talk
I always
to the
tell people to do
handlers.
that. Yeah.
Get to know the handlers. Get to know the dogs. So that's it. And preparation is better than cure, I think. Like you said, if you're prepared and you've got all those things, then you should be good, and it'll make a difference. Chris, thank you so much for your time. It's really appreciated. A little bit of further information for anyone that's interested out there. We talked about Teacher IC and canine treatment protocols and algorithms. You can go to the Deployed Medicine webpage, and they have canine protocols there. If anyone has any questions, they can email me at t.cranton@corom.edu.mt. And again, if you've got any canine questions, I'm sure I can contact you, Chris, if that's okay.
Absolutely.
And I'll use you as a point of reference. So again, Chris, thank you so much for your time. And I look forward, guys, to our next podcast. Thank you again.
My pleasure, brother. Appreciate it. Good talking to you.
This has been a presentation from the College of Remote and Offshore Medicine Foundation. If you would like to earn CPD credit for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credits, free access to the virtual field guide, and discounts on our e-learning courses. You can join the team on the college website, which is Corom, Corom.org.